Hello, Section 9. I hope this weekend wrap-up finds you all doing well. I apologize for the delay in this. I usually try to get these out on Saturday, but life got in the way. It's been kind of an interesting block one to start with, to have so many people affected by the hurricane and all of that, and what a struggle it must be to be living in Florida right now. So, yeah, my heart goes out to you guys in Florida. I hope you all are doing well, and hopefully you'll have electricity and some of the basic necessities soon for all of you as you kind of move forward. But as a general, I thought block one was good. We had a lot of good information, a lot of good sharing of how people handle different things. Some of this information and some of these concepts are new for some of you, and so it was great to see people kind of rethinking how they were going to do things. But let's get started. So, some housekeeping items. So, the course calendar flow. Remember, we're going to start block 3. You're going to post, block 2, week 3. You're going to post in the same groups for the next block. We will switch it up at the halfway point, and I want to make sure that you recognize that your initial discussion posts for the block 2 will be week 4 on Sunday. So a week from now, you'll have to get those up. And then the discussions begin on Monday. Again, I stress, do not wait until Thursday or Friday to respond. I really appreciate all those people who posted on Sunday afternoon, or even Saturday for that matter. It allowed me to dig in, and because I haven't, so many posts to get after, I want to be able to do it so that it does encourage discussion. And those who got them in earlier, I do appreciate that. Not necessary, but I just appreciate that. Fit cases is due at the end of the second week. There'll be discussion about that, and I know there's only one fit, but a lot of people enjoy kind of taking a peek inside and seeing what the requirements are for fits. If you're interested in becoming a fellow or going through the fellowship, checking it out, just peek in and see the discussions that James and I will be having, and maybe kind of consider what you would be doing in some of these case scenarios, if you will. Okay, so next thing. So in regards to highlights from the week, the medical screening stuff, all patients, regardless of method of PT access, that's who we should be screening. So it doesn't matter if they're direct access, because primary care misses them all the time. Ortho misses these kinds of things all the time. We need to be vigilant in whoever we see, and everybody seemed to be understanding of that. Continuous over a course of care. It's really important. I just gave a CE course. I was speaking at a CE course this weekend. We were talking about upper cervical spine and manipulative care. And when you do that, and are you ever absolved of your responsibility? And you're not. And the same is true with any of this. So you're always looking for red flags. You're always monitoring for those. You're always looking for yellow flags in which you're going to see people be challenged. And I challenged a couple of you. I think yellow flags, I think we should be owning yellow flags. I understand that there's a limit to our skill, but so many people have psychosocial issues that we totally can address. And obviously there's a limit, and that's why things like PHQ2 and PHQ9 are helpful in helping us find the appropriate care. But so much of it is driven by this anxiety around pain and understanding what pain represents and why we have pain. And those are completely yellow flags. I work on a guideline committee here in the state of Minnesota that is published for primary care, and the guideline has changed, and we're rewriting it. We did one. The last version I was on was in 2012. Now here we are in 2017. And the big deal is yellow flags. There's a much greater emphasis on yellow flags and this is for low back pain. Sorry, I didn't say that, acute low back pain, and really getting to address those and how we address those. Narcotics are off the table. Physical therapy is a big deal, and so is chiropractic care. And even I push back on whether they're prepared to handle treating people with yellow flags. Do they have the education, and is it part of their curriculum? But we certainly are, and we need to own that. Outcome measures. Understand properties. MCID is helpful to know. Yeah, so I think MCID can be helpful. I think you should also understand that MCID has its limitations, and some of the recent research has said that MCIDs really apply to patient populations and may not be generalizable to the whole public. But stay tuned for that. And then pain neuroscience education, or P&E. The stories, the metaphors, everybody seems to have a good handle. A lot of people who are new to the profession are sometimes struggling with those hard people to relate to, and how you what angle you go at to get after them who've had chronic pain. And Adrian Lowe would say that we can reach about 40% of those with chronic pain because these people are tough, and we're a lone voice in the wilderness when we start talking about what pain represents. And when they're getting hammered from primary care, from ortho about imaging, it's really hard to push up against that, or even physiatry, neurology, neurosurgery, all these people who become so biomechanically based. It's going to require a sea change, and that change is happening. I know that at our system that I work in, I'm part of a group that's changing the language that we use, especially for low back pain, and then now it's into chronic pain. It will start to sprinkle into other things. This takes time. It takes persistence. It takes a lot of empathy and understanding where these people are coming from, because a lot of these people have so many other issues that are pounding on them that you don't even know what they are. And so just understand that, man, when you have pain, life sucks, and I don't care who it is, and nobody wants to live in pain, and nobody's trying to get attention from you, and nobody's trying to malinger, God forbid, that these are people who have real pain. And maybe it's exacerbated by many factors that we don't even understand, and the only way we do that is through empathy and through letting them know that they are listened to and understood. All right, looking ahead. So, evidence-based management of selected hip disorders, it's really good stuff. How we treat hips. I look forward to hearing kind of how you guys do that, because I love hips, man. Nothing like a good hip to start the day and make people feel significantly better. Residents, MTC virtual rounds. Be on the lookout for emails and announcements, and contact me with any questions. Do not hesitate. Again, I would say that I just thought everybody did a really good job from a grading standpoint. The grading book changed, and so I have to go back and rearrange my grades, and I will do that because I had to manually put them in, but I didn't do them correctly, and I'm going to go back and change them. But just know that everybody was doing really well. The one thing, though, that I have to stress is that please look at, in Dropbox, the Group 1 block. In the block, there's the groups for Block 1, there's lecture handouts, there's required readings, there's block instructions. Remember that when you're going to post your articles, please do so if you have research, and I really encourage you, so that you're going to get a higher score from me if you can back up what you say from research. And if you say, I don't know what this is, that leaves me unsettled. So I want to encourage you to use these, post your articles. If you can't find the articles, then let me know and I can help find them. We've got people who are doing it. I know that I posted, a bunch. I try to show you what I'm looking for by demonstrating with my articles that I post. So do consider that. Otherwise, everybody did relatively well. I think I gave anything less than a 90, and especially taking into consideration all of the Floridians and their struggles. So take good care. If you have any questions, please don't hesitate to reach out.